The Africa Centre for Disease Control warns that surging third wave of COVID-19 in Kenya is slowly shutting down both the public and private institutions as the virus holds sway amid soaring deaths and infections. And as this wave takes new shape, we speak to health expert Dr. Mary Stephen to take us through the reports that in Kenya alone, new infections has shot up by 400% over the past few weeks. We ask her if Africa is indeed ready to handle a third wave of vaccination progress and to look into reports some European countries are still hoarding vaccine doses. Dr. Stephen is the technical officer of the World Health Organization Regional Office in Africa in Brazzaville, Congo. Dr. Mary Stevens, a very good evening to you. It's always a pleasure having you join us on this on the globe. Thank you so much for joining us.
Thank you for having me. Good evening.
I guess it is the big question that is on everybody's minds. Is Africa ready for the third wave?
That's an interesting question. We have had 2 waves of the outbreak, and of course, we are seeing cases increasing in some of the countries like Kenya. We have come a long way in this outbreak. We have learned a lot, and I believe we can continue to build on what we have learned in the process of the response to get ready for a potential third wave, but making sure that we are not lowering our guards. We have to continue to implement the effective public health measures we know: surveillance, testing, contact tracing, isolation, treatment, preventive measures of wearing our masks, making sure we keep our distance away from others, washing our hands regularly, and avoiding unnecessary mass gathering. We know these are effective measures, and we need to continue to implement them as we source for vaccinations and continue with campaigns in countries.
Now, Dr. Stephen, the 400% infection rate in Kenya cannot and should not be taken lightly. So in terms of your analysis and observation of how the country has been dealing with the containment measures of this particular virus, where is that country in containing it?
Yes, so most of the countries where you are seeing cases surging, it's as a result of course, relaxation of the measures put in place by countries to reduce the spread of the outbreak. And secondly, COVID-19 pandemic fatigue. And thirdly, people are beginning to have a lower sense of risk concerning the spread of the virus, and so they are lowering their guards. So these are some of the issues. But like I said earlier, we have public health measures that are effective, including the preventive measures, and that's what Kenya needs to continue to implement to curb the spread of this third wave.
Yeah, and this third wave, Dr. Stephen, does it have to do with the probable mutation of the virus, or is it social considerations, human behavior especially, taking into cognizance that people still don't want to stick by the COVID rules?
Okay, I'll go with the social behaviors first. We have seen from the first, second waves that when people begin to engage in mass gathering and refusing to wear their face masks, we see surges, especially during peak period for travel. We saw that in December, and now towards the Easter period, we are beginning to see cases surging as well. But the issue of the mutation and new variants of COVID virus could also be a contributing factor, but we don't know for sure in Kenya whether that is the case, because some of the new variants are thought to be more transmissible. So this could also propagate the outbreak, but most importantly, the social behaviors of people.
But is it too late to prevent the third wave consequences?
It is not too late to prevent further spread of the third wave. What we need is to ramp up all the measures, making sure that the surveillance is in place, tracking all the contacts, and isolating, treating those patients, and the general population, mass gathering especially, making sure that if you don't need to go out, it's better to stay at home. And if you have to go out, make sure that you're wearing your face masks, you're at least keeping that 1 meter distance away from others, and observing hand hygiene.
Are you at liberty to share with us the severity of the third wave? I mean, will it be the same severity we experienced in the second wave?
Well, it depends on how we respond to it, actually. And secondly, the fact that countries have started vaccinating, there is every chance that we could reduce the transmission in the third wave. But the most important thing is to make sure that we are not relaxed. We have to continue to implement these measures and reduce further spread of the outbreak.
I mean, the experts say the magnitude of the surge will depend on the pace of the vaccinations, and some reports have been coming through, especially here in South Africa, that the health experts are actually battling to reach the target of 1.5 million vaccination, especially on the healthcare workers. And then, in terms of the vaccination drive, would it be enough to curb the third wave?
Okay, so as you know, the issue of vaccination in Africa has been a challenge, access to the vaccine. Currently, most of the vaccines we have in countries is from the COVAX facility, some bilateral arrangements and donations. And this is prioritized for health workers, some other essential frontline workers, the elderly, people with comorbidity in most countries. So they are given to priority. Population, healthy people are still not eligible for this vaccine. And so if they interact, they can actually drive transmission out there. So we need the vaccine, but together with the vaccine, we also need to implement those preventive measures, because even with the vaccination, it will take some time for us to get to that level of herd immunity.
Well, we've seen South Africa exporting the Astrazeneca vaccines to the African Union for redistribution to some other African countries which haven't seen a mutation of this coronavirus. And Dr. Stevens, you and I agree that, I mean, we've been seeing reports, especially in some European countries, that there's been some severe side effects, as it were. Those who've been taking that jab have experienced blood clots. But then the WHO is still insistent that there's absolutely nothing wrong with this AstraZeneca. Is the WHO still maintaining that position? And if so, why?
Yes, so the COVID AstraZeneca vaccine is still safe and effective. And there has been a review of the data from with regards to the report in Europe. So the benefits still far outweighs the risks. But as you know, even with other vaccines, not just with COVID, side effects following immunization do happen and can happen with any vaccine at all, not just limited to COVID vaccine. The most important thing is to make sure that we are doing surveillance to track these adverse events and assess every adverse event happening around any vaccine, not just even COVID vaccine, but even specifically for the COVID vaccine, continue to do the surveillance. But the assessment has shown that the risk of blood clots is not higher than what you find in normal population, even in Europe, where they noticed that. So it's still safe, it's still effective, but we have to continue to do surveillance to track adverse events.
And those who've already taken the jab, are they immune to the third wave? Are they out of the woods?
I think this is a very important question. For most of the vaccines, people need to take 2 doses. Even if you're vaccinated, does not necessarily mean that one is 100% free from contracting COVID. But we know that even if you contract the COVID, if you have taken the vaccine, for instance, at least it protects from severe disease. So there is evidence that it protects people from severe disease. And if it protects people from severe disease, then it will protect ultimate deaths. So reducing the burden on our hospitals, ICU capacity, where we have to admit a lot more people. But even if one is vaccinated, we have to continue to observe the preventive measures.
So, Dr. Stephen, if you were given an opportunity to have a conversation with African leaders, would you advise them, to slow down the economies? Because some of the African, well, some, if not all, African countries still haven't recovered from the economic paralysis as a result of the pandemic. So would you advise them, to start implementing very stricter lockdown measures as the third wave is nigh?
So actually, it depends. Not just applying measures blindly, But any country that would like to apply any measure at all to curb the potential of a third wave, they need to do that based on risk assessment. So weighing the risks of transmission and as well as the impact on the economy, and where possible, implement some of those risk mitigation measures. So not just a blind implementation of measures, but we are doing it based on evidence.
All right, Dr. Mary Stevens, great chatting to you. Thank you so much for your update.
Thank you.